Welcome back. Indeed, Killer did tell you that we're shifting gears, and this time around we're looking at the crux of governance, which is, why people are in government, and which is to protect and save the lives of people whom they preside over. But in this instance, sadly, we've lost 13 lives in Niger State as a result of cholera. This morning, we're looking at that particular issue because cholera had been predicted. Usually in the rainy season, we do get incidences of cholera outbreak. But in Niger State, this incident had come to the fore because of the floods that happened in May in Mokwa local government area. Part of what analysts had warned of was the issue of an outbreak of cholera. Interestingly, this outbreak is not in Mokwa local government area. It's happening in other local government areas such as Boso, Mina, Magama, Bida, and Munya local government areas. So the question is, have we paid so much attention to Mokwa, leaving out other areas of Niger State where this outbreak has now been reported? Well, joining us to discuss it, we have the pioneer chairman of the Primary Healthcare Development Agency, Dr. Ibrahim Dangana. Thank you so much, Dr. Ibrahim, for joining us this morning. I believe that you can hear me, so I'm just going to ask the very first question. Okay, well, oh dear, I understand that Dr. Dangana was having troubles joining us. It was just there a moment ago, and it does appear that we are having an issue connecting with him. But this is a situation in Niger State where our correspondent is reporting that over 13 lives leading to the hospital, 13 lives have been lost, and over 236 individuals have been hospitalized as a result of this cholera outbreak that has now happened in Niger State, affecting about 6 local government areas. Well, I understand we have Dr. Ibrahim Dangana back with us. As I did introduce him earlier, he is the commissioner of the Primary Healthcare Development Agency in Niger State. Good morning, and thank you for joining us, Dr. Dangana.
Good morning. Thank you for having me.
Well, this is a situation. We know that every rainy season, we usually will have these incidences of cholera across different parts of the country. It does appear that Niger State is recording its own incidents about now. I think it's about the first being reported. You can correct me if I'm wrong, across the country. There had been a prediction that this could happen in Niger State as a result of the floods that happened in Mokwa in May this year. But it's unclear if this incident that has now happened is linked to what had happened in Mokwa local government area. Are there any linkages?
No, not at all. There are no linkages with the current cholera outbreak in the state to the flood that occurred in Mokwa. There is no linkage. To get things straight, cholera is an endemic disease in Nigeria, but it usually peaks during the rainy season. The current 6 local government areas affected in the state does not include Mokwa, where the flood disaster happened.
Indeed, I mean, I already noted that, but some people will say, okay, is it possible that as a result of paying a lot of attention, because when we predict something in a particular area as a result of a disaster, resources will go towards that area. Perhaps as a result of that, other areas now suffer. Do you think that maybe not directly linked, but indirectly, would you agree that that could be a situation that has now happened in Niger?
No, not necessarily. If you look at the NDC data from the Nigerian Centers for Disease and Control, from the 1st of January this year to date, a total of 25 states have reported cholera cases. We've recorded a total of 1,149 cholera cases with 28 deaths across various states of the Federation. So this is just happening because it is the rainy season, and we know the factors or the risk factors responsible for cholera transmission. The key thing here is to sensitize people, because cholera is usually transmitted from contaminated food and water sources. So you have to increase the risk communications to various communities. But cholera is endemic with us and occasionally uses sporadic spikes in the occurrence of cases like we are witnessing currently in Niger State.
One of the areas or one of the ways to prevent cholera is through upgrading the WASH program, which the UN, United Nations, has been championing this sanitization and stopping open defecation, etc. Because at the end of the day, this is what it usually results into. And a number of, well, I say, initiatives have been on board. Some states have taken it up. And in some instances, we understand that some states have been successful in getting rid of open defecation in their states. For instance, Jigawa State, these are not my statistics, these are statistics from the UN agency that oversees this WASH program. How would you say that Niger State is faring in this regard?
Yeah, there are ongoing efforts to strengthen the public laws across the state, and also to provide more public toilet facilities, especially within crowded areas like market areas, the motor parks, and other places. However, it's not just open defecation alone that contributes to the transmission of cholera. Like we said, you could have overflowing during the rain seasons that will affect drainages, that will affect the waterways. So these are some of the risk factors. And of course, people have to have a high level of personal hygiene and environmental sanitation. So in this case, it's multi-sectoral, of course, like you said, involving quite a number of government agencies, the water resources, environmental, Ministry of Environment, the state agency for environmental protection, and of course, even some other agencies that have a part to play in terms of WASH and sensitization. So across the states, there are quite a lot of attempts to strengthen intersectoral collaboration, and a lot is being done. And currently, there are also ongoing reviews to strengthen the law setting up these agencies. We aim to also achieve a zero tolerance to open defecation, just as part of contributory measures to control this menace.
So right now, what are the measures that you're putting in place? We know that over 236 individuals, we understand, have now been hospitalized across different areas of your state. This clearly looks like some sort of emergency that seems to be coming up, because it's unclear how, if we're going to be able to mitigate this, or whether we're going to see more patients reporting at the hospitals. So what plans do you have in place for either of the scenarios?
So, of course, we are succeeding in the attempt to control the infection across the state. What we've done is we have activated the State Emergency Operations Center and the Incident State Rapid Response Teams. We have deployed consumables, essential supplies, including intravenous fluids, to all the affected communities. We have identified the Cholera Treatment Center, CTC units, across all the 25 local government areas in the state. The good thing is we are not making effort in just the affected local government areas. Of course, we are reaching out to the entire nooks and crannies of the state. We have deployed all our teams currently. We have reached more than 16,000 school children. We have visited a lot of schools, churches, mosques, places of religious and social gatherings. We've sensitized the state. We have distributed education and other EC materials. And of course, we are regularly on the air and the media sensitizing people about the importance of environmental sanitation, personal hygiene, and also being very careful about the sources of water they use and also their food. And for people to also sort of sanitize the water they use. It could be by way of boiling, but at the home front level, with the support of partners like UNICEF and the WHO, we have distributed a lot of water sanitizing agents to this household. I think so far we have reached more than 14,000 households across different communities within the span of the last 2 weeks. So we are succeeding. We are getting results from the effort that we have deployed in the field. And of course, one of the key things we're doing is we have activated the disease surveillance across all the 25 local government areas, and we're involved in active case searching.
Okay, I was just about to ask you about the other local government areas, because we see that 6 local government areas. Where these local government areas where this disease has now been reported, this disease outbreak has now been reported, did you think that they were high candidates for this sort of outbreak, the outbreak of this disease? Are there areas where you constantly see this outbreak year in, year out?
No. Cholera can be sporadic. Like I told you, we live in a cholera endemic country. and it usually peaks during the raining season, presumably because you could have, flooding that, like I explained earlier, will affect drains and other sources of water supplies with contamination. So they are not particularly prone to they do not display higher risks than the local government areas. But like we said, the epicenter is around 2 LGAs, which then spreads to additional 4. But measures put in place currently are working to contain further spread of the disease.
Okay, it's good to know. I mean, the words I was looking for was the risk, high risk areas. And it's good to know that you're putting in place, other measures for other local government areas. But I'd just like to also find out from you what it is, because you have mentioned over and over again that cholera is endemic to us here in Africa. And every year we see this outbreak during the rainy season. However, as a result of seeing it, shouldn't we have by now, will I say, a high awareness of what could be happening? Shouldn't medical personnel have a high level of suspicion, I think that's the word they use, a high level of suspicion when certain cases are presented, so that we do not necessarily lose lives? 13 people being lost to cholera in Niger State alone is quite worrisome, don't you agree?
Yeah, but unlike other cases, you do not really need a high level of suspicion. Once you report a case of gastroenteritis, acute watery diarrhea, of course, we treat such cases as cholera. But we've deployed rapid diagnostic test kits even in the field. So for all the affected LGAs and indeed all the other ones, once any case of diarrhea has been reported, that we treat it immediately as a case of cholera until proven otherwise. The goal is to provide prompt treatments to affected victims, because cholera is lethal and can dehydrate the victim within hours, leading to death. So what you need to know is that beyond the medical personnel alone, like I said, it's a wash disease. The environment has to be very clean. We have to be top-notch in terms of evacuating refuse collections within our environment. We have to ensure that we have potable water supplies to various communities. And of course, these are developmental challenges, but the state, with the leadership of Mr. Governor, is doing everything it can to ensure that these issues are being resolved. They are developmental challenges, but we've coordinated closely with our sister NDs. Currently, we are supplying portable water supply to the affected communities, and the environmental sanitation is up and about, ensuring that there are prompt evacuation of refuse across all the LGAs, not just the affected sites.
Would you say that there is a sense of urgency? Because, I mean, you're speaking right now, and it does appear that, you have very clearly things that you ought to do, but you've also said that these are developmental challenges. The sense of urgency with which we need to tackle this so it doesn't spread and we don't record more loss of lives, would you say it is presently on the ground in Niger State?
Indeed it is. Indeed it is. And the governor is very much involved in our coordination effort. So the goal now is to sensitize, reach the maximum number of people, and indeed everyone, with the clear message and sensitization that, look, we have this outbreak going on. People should be very aware to increase their level of personal hygiene, environmental hygiene, and ensure that they watch their sources of water and the sources of food to avoid some form of contamination. Hand washing hygiene education is going on across all the schools in Niger State. So I think we have saturated the media with the key messaging that people need to know to take actions to prevent being infected.
All right, I understand my colleague Kayla has a question for you. Over now to you, Kayla.
I listened to you earlier, and you were talking about how, the flooding in Mokwa, in your view, didn't have anything to do with this particular outbreak. But I get why you would say that. But the truth is, when we look at cholera in itself, unsafe drinking water, poor sanitation, and inadequate hygiene, these are some of the places where, when you have these situations, then cholera will be rife in places like that. Following the flooding in Mokwa, what protective measures were put in place to ensure that those waters from those floods don't get into the drinking water of the communities? These 6 communities, Shiroro, Boso, Mina, Magama, Bida, and Munya. Can you categorically say that some things were put in place to ensure that those flood waters from Mokwa didn't sweep up all that dirt and debris and, you know, and all of those things into the drinking water that may have caused this? Can you say that categorically?
So like I explained earlier on, if you can hear me, the current outbreak has got nothing to do with Mokwa. The flood disaster in Mokwa is different, and these local governments are not even contiguous to, Mokwa local government area. But the Ministry of Water Resources, in close collaboration with the Ministry of Environment, are putting in place measures to ensure that the waterways are clearly desalinated. We removed any blockages within the drainage systems.
So, Dr. Dangana, Dr. Dangana, I need to answer my question, which is, you say that they are not related. My question is, what was put in place to ensure that the flood from Mokwa and all of that debris and dirt that it carried didn't get into the drinking water in Niger State, in any of the communities? Because water didn't just stay in Mokwa. It moved around. It dispersed into other parts of the state. So what was put in place to ensure that that didn't happen?
Well, you know, if you have to understand the rivers and the drainage patterns. Like I said, the flood in Mokwa did not in any way travel to these affected local government areas. They are far removed from Mokwa. So the flood in Mokwa dissipated and dried off. It has its own natural channels of emptying. But for the affected local government areas, the Ministry of Environment, in conjunction with Water Resources, have already been on the field, and they have looked into the entire sources. We are looking at the likely source of infection. So measures have been put in place to ensure that people don't put refuse in these drainage pathways so that we don't end up having contaminations. And again, we are sensitizing the farmers and market women about ensuring that there is sanitation around the market and the food sources they provide. The Water Resources has also visited the water manufacturers and educated them on ensuring this is ongoing in all the water producing facilities, because it's very difficult to pinpoint the accurate source of infection. So it's to look at all the possible sources where you may likely have this infection and take the specific step needed, and that is what the state have done. And currently we are winning this fight. The number of cases has actually declining, not increasing.
All right, Dr. Dangana, we certainly will keep tabs on Niger State, and we do hope that, you know, the incidences or the fatalities from this particular incident will certainly be on the down low, as you are hoping, because we understand that those who have largely been affected are children, and it's really heartbreaking to, you know, to hear that, and we do hope that we're able to stem this particular tide of cholera in Niger State. Thank you so much for speaking with us this morning. Dr. Ibrahim Dangana is the Commissioner of the Primary Healthcare Development Agency in Niger State.